Okay, so this is my one contribution. Don't get used to it. Okay, so this is how I remember the cranial nerves. Keep in mind that I literally came up with this like 10 minutes before an exam. So there's definitely a lot of stuff missing. Let me know what is missing, and let me know if something is horribly inaccurate. That being said, it's supposed to just be a general overview of the cranial number, name, and its overarching general function, what it innervates. So that being said, it is based on using your fingers to remember the nerves. So there are 12 cranial nerves. You're going to need all 12 fingers. So if you don't have polydactyly, if you only have 10 fingers, you should really just stop watching this video right now. Turn it off because it's not going to help you at all. You need all 12 fingers. Hopefully no one stopped watching. Okay, so I'm going to try to do this in 10 minutes or less. Let's go. Okay, 1. Simple. Olfactory nerve. Smell your finger. Just put your finger up to your nose. Smell olfactory. Easy. 2. Optic. You point at your eyes. Simple. I mean, you see with it. Easy. 3. You point and you look at things. You move around and you focus. You focus your 3 fingers on something, and that's a key word because that's what this nerve does. It focuses. It constricts the pupil and it works that lens and it moves the eye around because it does all of the muscles of the eye except for 4, which is up, and 6, which is outwards. So doing that again, it's 4 trochlear and 6 abducent. Okay, we skipped cranial nerve number 5. Cranial nerve number 5, it sucks. This is trigeminal. So here's what you do. You take your hand, 5 fingers, and you wipe your face right there. You just wipe your face 1, 2, and 3. Then you take your hand and you bite it, and you chew. Okay, so here's what that means. Trigeminal nerve, there's 3 different innervations. The first one, that is ophthalmic. That goes down to the bottom of the eye. So that's where the first wipe gets. Second wipe, that's from below the bottom of the eye down here to the lateral portion of your nose and the top lip, and that is the maxillary area. And then the third one is mandibular, and that's mandible. Easy. Done. The second part, the part where you bite, that is teeth. It also innervates teeth, I suppose. And the chewing bit, that it gets all the muscles of mastication. Okay, there's your trigeminal nerve right there. Easy. What's next? We did 6. 7. 7 also sucks, and this one, it's kind of a stretch because it does so many weird things, but just work with me on this one. 7. This is the facial nerve. So you take your 7 fingers and you put them up to your face, and then you pretend that there's spiders on your face. Yeah. And then, so then, what do you do when you have spiders on your face? You're gonna make a face. You got spiders on your face, right? You're gonna try to get them off maybe with your face, and then there's spiders on your face. You can't do anything. You're gonna cry. You're gonna cry, and when you're crying, your nose is gonna start watering, and then you're crying so hard you're gonna start drooling. So let's run through that. So cranial nerve number 7, facial nerve. That innervates all the muscles of the face, all the expression muscles. So that's you trying to get the spiders off. It gets the lacrimal glands of the eye, so you're crying, and when you're crying, your nose is watering, so the nasal mucosa also innervated, and what else did we say? Oh, the sublingual and submandibular glands that create saliva, that also is innervated by cranial nerve number 7. And one more thing, one of the spiders, it kind of, when you're crying, your mouth's a little bit open, you left it open, and one of the spiders kind of crawls in your mouth, and you taste the spider with the anterior 2/3 of your tongue. So it also, cranial nerve number 7 gets the anterior 2/3 of your tongue. Easy. That takes care of that. Number 8, vestibulocochlear nerve, also called the acoustic nerve. You can do it like this. Just point at your ears. Chen came up with doing it like this. Whatever floats your boat. Vestibulocochlear gets balance, gets hearing, enough said. Cranial nerve number 9, glossopharyngeal. This one kind of sucks. It's a mixed nerve, so it's not very straightforward, but just work with me on this one. Take these 9 fingers and you put them up to your throat right here, and you make this weird noise. You go. Okay, so what does the glossopharyngeal nerve do? That gets your pharynx, your pharyngeal structures. It gets your tonsils, and that noise I'm making. Where am I making that? I'm making that with the posterior 1/3 of my tongue. So that's what the glossopharyngeal nerve does. It gets taste for the posterior 1/3 of the tongue. Also gets the parotid gland. You might just have to remember that one. I just kind of remember it. It'll be okay. Cranial nerve number 10, vagus nerve. This one's easy. You just 10 fingers over here, whatever you want to do, like this. I don't care. It's the only nerve that comes down below your neck. I mean, you guys know it pretty well. Comes all the way down, so you can just follow it down. Everything it touches in a nerve. You got your larynx, your pharynx, your what else is over there? Your esophagus, your esophagus, your trachea, your lungs, your heart, your gut. Easy. Let's move on. Cranial nerve number 11, accessory nerve. This is easy. 11, sternocleidomastoid. Easy. Sternocleidomastoid and trapezius. Pretty easy. Finally, cranial nerve number 12. So let me do that again. 10 and 2, 12. And you just point at your tongue because it gets all of the muscles of your tongue. And that's all of them. Let me run through them again. I'll give you a little bit more information this time and try to clear up some things. Okay, so 1, easy, olfactory, smells, done. That nerve, you might have to double check me on this, but I'm pretty sure that's the only nerve that doesn't really exit the skull. It's on the posterior surface of the brain. You have two tracts running, and that's your olfactory tracts, and it ends in these 2 nubbins on the bottom side of your brain called the olfactory bulbs. Cranial nerve number 2, that's the optic nerve. So you guys know that the nerves, when they're coming backwards from your eye, they split. Each one splits, and 2 of them cross over at the optic chiasm. So what that means is that divide each eye into each receptive field of the eye into halves, and the left halves go to the right portion of the brain, and the right halves go over to the left portion of the brain. Cranial nerve number 3, the oculomotor. You point and you focus because that does the pupil, and it constricts the lens, and it moves all of the muscles of the eye except for cranial nerve number 4, trochlear, and cranial nerve number 6, abducent. So let's do that one more time. Trochlear, up, and that would be the superior oblique muscle of the eye. And that muscle, it kind of runs backwards, and it goes over this ligament, kind of like a pulley. It kind of just pulls back, and that's why it's called trochlear, because trochlea means pulley, just like trochlea. 6, abducent. That gets the lateral rectus muscle, and that does the lateral movement of each eye. The oculomotor gets all the other movements of the eye. Okay, so we did 3, so we got to get to 5. 5, trigeminal nerve. Keep in mind that this does the facial innervation, sensory innervation of the face, whereas 7 does the muscles. Keep those separate. It's easy to get those two confused. So this, let's go over it one more time. The top part, ophthalmic, that's up to down to the bottom portion of your eye. The maxillary, which is the lateral portion of your nose, and below your eye, this whole area right here, and your top lip. And then mandibular, which is your bottom lip, all the way up your mandible, done. It gets your teeth as well, and the mastication muscles, all of them. Not all of them, but most of them. The big ones involved in mastication. We did 6. 7. Facial nerve. It's spiders on your face. So you're trying to get spiders off. You're moving your face. It's only the muscles, not the sensory innervations, because the trigeminal gets the facial sensory innervations of the face. So it's just the muscles of the face. And also you're crying, so your lacrimal glands, your nasal mucosa, as well as your submandibular glands, and your sublingual glands. And also that spider crawled in your mouth and you tasted that spider with the anterior 2/3 of your tongue, so it gets the taste for the anterior 2/3 of your tongue. Let's see, what else? I think that's it for cranial nerve number 7. Cranial nerve number 8, easy, we don't even talk about that one. Cranial nerve number 9, glossopharyngeal, that has your parotid, which you might just have to remember up here, I guess. Cranial nerve number 9, you made that weird noise with your throat, so that's the posterior 1/3 of your tongue that gets taste. You know that cranial nerve number 7 and 9 only get taste because the hypoglossal nerve, number 12, gets all of the motor functions of the tongue. So 9 also gets the pharyngeal structures as well as the tonsils. And 10, vagus nerve, I don't even go over it. Keep in mind that 5, 7, 9, and 10 are the horrible. They're the nerves that suck. They're the mixed nerves of, like, sensory, motor, special sensory, all of those things put together, and they suck. And you can tell because those are the weird ones that you do all the weird things with the spiders and the. Okay, so what else? We did 11 easy, 12 hypoglossal. We did that. I think that takes care of everything. Can't remember anything else. I'm pretty sure that's anything. I'll make another video or something if I forget something, or I'll just post. Do let me know if I forgot something. And so I did my bit, and hopefully it helped somebody. Cheers.